Right now, your cat may be in pain and you have no idea. Not because you are a bad owner, because cats are biologically programmed to hide it so well that it can be difficult to detect, even during routine checkups. There are 10 signals. Most owners see them every day and call them something else: age, personality, a bad mood. By the end of this video, you will never make that mistake again. If you are still watching, you already care more about your cat than most owners ever will. Keep that in mind, because signal 5 is the one that will change how you look at your cat every single day from this moment forward. Signal 1, sudden aggression. Your cat has never bitten anyone. Then one day they bite you without what seems like any warning or provocation, and you feel confused and hurt. Here is what almost no one tells you. That bite is not a behavior problem. It is a medical symptom. Research on feline pain behavior confirms that sudden, uncharacteristic aggression is one of the most reliable indicators of acute or chronic pain in cats. A cat who bites when touched in a certain area, or who has become generally intolerant of handling they previously accepted, is not changing personality. They are communicating that something hurts and that the interaction is making it worse. Think about it this way. If someone pressed on a bruise you did not know you had, your first reaction would not be calm explanation. It would be flinching, pulling away, maybe snapping. Your cat cannot say stop. That hurts, so they say it the only way available to them. The bite is not the problem. It is the message, and the message deserves a vet visit, not a behavior correction. Signal 2, the squinting eyes. Guess which part of your cat's face tells a veterinarian more about pain than almost anything else? Most owners never think to look at it: the eyes. Veterinary researchers developed something called the feline grimace scale, a scientifically validated tool that measures pain in cats through facial expression alone. And if you have never heard of it, you are not alone. Most cat owners never have. A cat in pain squints, not fully closed. A subtle, persistent narrowing that is different from the relaxed half-close of a content cat, combined with ears rotated slightly outward, whiskers pulled back, and a muzzle that appears tense. This facial pattern indicates active pain with clinical accuracy. Look at your cat's face right now. Relaxed eyes are soft and open. Squinting eyes, in a context that does not involve bright light or sleep, are a signal. Most owners who learn this realize they have seen it before. They just did not know what it meant. Signal 3, the changed resting spot. Think about your cat's favorite high spot. The top of the cat tree, the shelf, the back of the sofa. Are they still using it? If your cat has quietly stopped accessing spots they used regularly for years and now rests only at ground level, most owners assume preference change or age. Cats with joint pain, arthritis, or spinal discomfort quietly abandon elevated positions because the climb has become painful. They do not announce this change, they simply stop going up. The absence of a behavior is as meaningful as the presence of one. If your cat has stopped using a favorite high place, do not assume they lost interest. Assume something made the journey uncomfortable and investigate. Has your cat changed any resting spots recently? Tell us in the comments. These patterns are the ones most owners notice only in hindsight, and recognizing them earlier changes everything. Signal 4, selective grooming. A cat who licks one specific area of their body repeatedly and intensely is not bored. They are locating pain. Obsessive grooming of a single zone is a cat trying to soothe localized discomfort through the only tool available to them. The opposite signal is equally important. A cat who has stopped grooming their back or whose coat is becoming matted in areas they can no longer reach comfortably may have arthritis or spinal pain that makes certain positions impossible. Not bored, not lazy, in pain. Signal 5, The rigid loaf. The loaf position, cat tucked with paws underneath, eyes half closed, usually indicates contentment. Most owners know this one, but there is a version that means something completely different. And this is the one almost nobody recognizes. A cat in abdominal pain holds the loaf with a tension that is visible if you know what to look for. The body is slightly hunched, the shoulders appear contracted, the head is lower than usual, the expression is not soft, it is held, a relaxed loaf looks liquid, a pain loaf looks braced. Translated into practice, next time your cat is in loaf position, look at the muscle tension around the shoulders and the expression around the eyes. Those two details tell you everything. Signal 6, food texture changes. Your cat has always eaten dry food. Then one day they start leaving it untouched and only eat wet food. Most owners adjust the food without asking why. Resistance to hard food textures is one of the most common and consistently overlooked signs of dental pain in cats. Tooth resorption, gum disease, and broken teeth are extremely common in domestic cats, particularly older ones, and cause significant chronic pain that goes undiagnosed for months or years because the cat simply adapts quietly. If your cat eats from one side of their mouth, drops food while chewing, or has shifted towards softer textures, book a dental examination. What looks like pickiness is often pain. Signal 7, touch reactivity. You run your hand along your cat's back and they flinch, twitch the skin, or turn suddenly. Most owners assume they touched a sensitive spot randomly. They did not touch a sensitive spot randomly. They touched a painful spot consistently. A cat who reacts to being touched in a specific area is telling you that area hurts every time. Map the reactions. If your cat flinches at the same spot on 3 separate occasions, that is not coincidence. That is information. Film it. Your vet needs to see it. Signal 8, litter box edge behavior. Your cat has always stepped cleanly into the litter box. Now they eliminate just outside the rim. Owners almost universally read this as spite or laziness. It is almost never either. For a cat with hip pain or arthritis, stepping over the rim has become painful, so they minimize it. What looks like poor aim is an adaptation to pain. The fix is immediate. A litter box with lower sides removes the barrier. A cat eliminating outside the box due to pain will often correct the behavior the same day the obstacle is removed. Squinting eyes, a changed resting spot, obsessive grooming in one area, a rigid loaf, food left untouched, a flinch at your touch, a sudden bite, a litter box avoided. How many of these have you seen in your cat and written off as something else? Tell us in the comments. Signal 9, night vocalizations. Your cat calls out at night, a low howl, a sustained yowl, no clear cause. Most owners assume age or confusion. They are often wrong. Nighttime vocalizations in middle-aged or older cats with no previous history of this behavior are associated in veterinary literature with pain, cognitive decline, and hyperthyroidism. Film it. Note the frequency. Bring the recording to your vet. That 30-second clip may be the most important thing you bring to that appointment. Signal 10, the empty stare. Your cat sits still, stares at nothing, does not respond to movement or sound. Not sleeping, not watching, simply absent. This is a cat whose nervous system is occupied with something internal, something that leaves nothing available for the world around them. If you see this regularly, document it, date it, show your vet. What to do right now? 3 things, no cost, immediate impact. First, film everything. A 30-second video of abnormal behavior gives your vet information they cannot get from a single clinic visit. Second, lower the barriers today. Low-sided litter box, steps to elevated resting spots, food and water at floor level, almost no cost, immediate relief. Third, do not wait for obvious. A cat who is visibly limping is already in significant pain. The signals in this video appear before that point. They are the early language, and now you know how to read it. Your cat cannot tell you when something hurts, but they have been trying to show you every single day in the only language they have. Now you speak it too.